Coronavirus, COVID-19. We'll talk about the major headings. I think is going to be where it came from, how it's going to spread, and how does it concern you, and then to assess the risks. First of all, let's talk about the etiology or the cause of this problem. Now, it is a new virus overall that popped into our health simply because we don't know where it came from. The closest thing to this is to SARS. The mortality was significant, but coronavirus, on the other hand, we don't know at this point where it first came from. The exact source at this point is undetermined. So first of all, this virus has been very infectious to the point that in a few months it has now caused a pandemic, which is global infections, and over 60 countries have reported incidents of infection. And there's a time delay possible from the time of exposure to the time of diagnosis. And we know the incubation period for this virus can be between 2 to 14 days, or maybe even longer, we don't know yet. What I tell my patients is going to be the same as to the world, is that the rate of spread depends on the person-to-person contact. So you can imagine all the places we go to, the people we meet, the countries and locations we travel. We don't know who has what, especially when that infective time can be 2 days to 2 weeks. And for that reason, the unknown is huge. And by the time we catch them at the end with a diagnosis, it is often quite late. Now, so for the individual, you have to look around you. What is your ability to prevent this from happening as far as infection, and how do you lower your chances of dissemination?